Hello, Lasalians. I'm Mion Espina from DBM1M, and right behind the cameras are my friends and groupmates Mark Pinco, Kurt Bueno, Shane Lee, and Jules Pangilinan. We welcome you all to today's interview, where we have the distinct pleasure of hosting a renowned figure in the field of psychology. Our guest today made a profound impact both on academic circles and television. You might have seen her on Magandang Buhay or Good Morning Kuya, where she provided practical tools for enhancing mental health and well-being. So join us as we explore the journey, insights, and future aspirations of the distinguished expert on psychology, no other than Dr. Camille Garcia. Good morning, Doc. Hello.
Hi! So nice to be invited. Super nervous pa ako bigla.
Oh.
considering na I have been talking ever since, and then all of a sudden, bigla nervous ako.
Doc, the pleasure is ours. We cannot thank you enough for granting us this interview. Which brings me to my first question, Doc. What made you say yes to us?
This is the answer. Papagalitan ako na anak ko pag hindi.
Bakit po?
Because today is the graduation day of Lasal and gagraduate yung anak ko.
Oh, okay, congratulations to your son,
My only son.
What's your son's name, Doc?
Jose Antonio.
Hello, thank you, Jose. Thank you. We're very grateful, Doc. Well, having appeared on TV numerous times as the go-to psychologist, how does purposive communication impact your career po?
Actually, it was Daniel Rason. You wanted to be a good speaker. You wanted to have a purpose with to communicate. Yung ganyan. Okay, sir. I'll come here every day. I'll teach you. I was placed in Pondahan. That is parang early show. 4 o'clock ng UNTV. Okay, Doc Camille, i-profile mo this particular politician. So it's so difficult in the sense that will I say something bad? Will I say something good? Will I say something that parang the truth? That's the difficult part.
Especially po if it's the device, no? Kasi these days, ang dali na ma-cancel online, Doc.
GMK, Good Morning Kuya is live. Face-to-face is not. For reasons na I think you saw the show na super may away.
Speaking of face-to-face, though, it made such an impact when you talked about your fight against the stigma on mental health. Kami po bilang students lang po, in your opinion, how can we help raise awareness for mental health?
Okay, first and foremost, siguro, the mere fact that you're going to show this parang sabihin natin, interview. One, you try your best to talk to a lot of people. You can invite some psychologists or yung parang interns lang ng your psychology interns to come up with yung parang meron certain activity, parang 2-day activity na they have parang group counseling in your school per se. Pero anonymous. So second, probably since you're in communication, why not have a spoken poetry contest on depression? Ginagawa ko yung project nyo.
Oo nga po eh.
Third, tinatawag natin first aiders. You will have parang psychology intervention first aiders. Very, very important tool when you talk about anxiety and depression. You talk to this person, probably mag-rant siya or mag-dump ng kanyang mga naiisip, but then eventually it will come up to a point na parang nagka-farsi siya, tapos siya, o wala siyang hindi siya aabot sa magkaroon ng symptoms na mag-attack ng suicide or even suicidal ideations or negative intrusion of thoughts.
Okay. But no, we cannot reiterate it enough. No? Guys, if you ever feel sick and tired of feeling sick and tired, remember to talk to someone and get help. Diba?
Yes, that's important. Talk therapy is parang siya yung first emergency na intervention. And then probably you guys will be able to help anybody, your friends or even relatives or even someone you do not know. And then all of a sudden, you save a life.
Very true. Now, Doc, just to lighten things up a bit, we wanted to ask you this only because we're curious. Because of your years of experience as a psychologist, do you find it challenging to not psychoanalyze every person you meet? Like, for example, Doc, are you figuring me out right now as we speak?
No, actually, it comes to a point na parang it's not about psychoanalysis. I make it a point to do parapsychology para it's something different. So when you talk kasi of parapsychology, it's more of yung parang intuitive na we talk about aura. It's more interesting rather than you do psychoanalysis. Parang, you have a yellow aura. It's not like tarot reading or something. It's more of yung parang how you see a person in terms of yung positivity or yung parang may negative na.
Like, can you visually see that color of aura?
Probably it's because of practice, yes.
Oh, okay. That's really interesting to know though. Having this much success in your field here in the Philippines, have you ever considered practicing abroad where mental health care is more normalized and sought after?
When this was established, 1979, the Feeling the Holy Spirit, it came to a point na I'm supposed to practice abroad. But then my grandmother died, and then parang nobody wants this facility na to move on or go on. Parang sige ako.
Would you say, Doc, na kaya rin kayo hindi umaalis kasi mas kailangan kayo?
I kind of thought before na what if we wanted to sell the place na kasi tapos ang nagiging problem namin, we have patients na ako yung guardian. And because their relatives are abroad, and then walang makikiter talaga sa kanila. Parang, ano yun, if we wanted to settle na in Batangas, sasama ko ba yung mga anim na yun?
Yeah.
So, ang hirap.
Actually, Doc, meron akong art professor from a year ago na something he said that really stuck to me. He was also asked the very same question, na bakit daw hindi siya magturo sa ibang bansa kasi magaling naman siya. And then his answer blew me away. Sabi niya, andito sa Pilipinas yung laban eh. Bakit ako aalis? So, yun yung sabi niya. Shout out to Sir Ron. Hello. Yeah.
That's true. Kasi, tingnan mo ha, sige statistic-wise, if there are 100 million Filipinos, and then sinasabi lang natin na 2% of the population are depressed and anxious. So that's 2 million. According to statistics, as of this time, there are only 400 practicing psychiatrists. 400.
That's it.
That's it. And then 400 practicing psychiatrists dito pa nakakumpul sa Metro Manila. Ilan yung nasa ibang regions. So there is this particular psychiatrist who caters to about mga 5 or 6 provinces ng isang region lang. So kahit na siguro general practitioner, parang magpa-practice rin ng psychiatry for reasons, no? Wala psychiatrist dun sa region na yun. Now, considering psychologist naman, for clinical psychologist, everybody na after graduation ng DS Psychology, how many are going into clinical psychology? Lahat gusto industrial psychology. Let's assume, dun sa 2 million, 1 million na lang yung sa mga psychologists. Dun sa 1 million, how many are going to look for a possible treatment? Kalahati na. So, 500,000. Out of the 500,000, ilan yung magkukontinue ng treatment? 250,000. Doon sa 250,000, ilan yung sabihin mong chronic at ilan yung sabihin natin na makakamove forward. Assume na lang din natin, 100,000. Eh kung ang 300 na ang clinical psychologist mo, 100,000 yung pasyente. Ay, yayaman din naman pala ako kahit sa Pilipinas ako. If you talk about financial gain.
Pag money-driven ka.
Pag money-driven ka, oo. Actually, kung masipag ako, masipag sorry. Parang,
Same though.
Hindi ako masipag, sorry. When you talk of a mental illness, the problem is, there is treatment with the episode, but there's no total cure. So meaning to say, after this time, padami ang mental cases.
On that note, what is your dream for the Filipino youth as far as mental health is concerned?
Actually, what I really wanted even before is to have a foundation. And foundation for the clinic, just for the youth. For reasons, mas maraming problems ang youth ngayon kaysa sa adults and seniors. Seniors, we are already considering the fact that people with Alzheimer's, with dementia, kaya may mga home for the aged, lahat automatic siya meron na eh. Pero for the youth, it's so difficult. Ang meron tayo, puro rehabilitation ng mga behavioral problems. Ang dami tayong problema from teenage pregnancy. Victims of child abuse. And although MHA, yung Mental Health Act is being parang promoted, unfortunately, it's so difficult na ibaba mo siya sa barangay level. Kasi parang even in sa barangay, it's so difficult for them to understand why mental health is so necessary, why mental health awareness is important.
And just to follow up on that, Doc, are there any specific mental treatments na ginagawa na sa ibang bansa, like let's say US, na kailangan natin i-normalize na gawin na rin dito sa Pilipinas?
The Mental Health Act per se is based on mga nakikita nilang magagandang practices abroad. Here, it's so difficult when you say a person is with mental disorder and then kinukulong. So, yun yung nakakalungkot because they don't know how they will be able to more or less bring the person to a facility sa isang public na mental health hospital. So, ang gagawin kinukulong. Definitely wala yan sa abroad. Most of the patients, pag mental cases, they go voluntarily sa mental hospital, especially in Australia. Australia and UK, ganun siya.
Okay, just to wrap this up though, DLSAU psychology students who may be targeting the same career path as yours, what advice would you give them?
Well, one thing, if you really wanted this career, try to look at it as a vocation. Because when you are into clinical psychology, it's not just a career, it's a vocation. It practices your empathy. And when you say you empathize with people, it's the ability for you to understand. It's not just observing. You just not hear the patient or the person you're talking to. You listen. And remember, pagdating sa ganyan, what can you do? You tell a person na, you're not alone. Because if you're alone, that's I stands for illness. But I am talking to you. So let's change the I to we. And that becomes wellness. Yeah.
You learned a lot today. Again, thank you so much for this opportunity, Doc. And meron kaming konting gift sa inyo, Doc.
Thank you.
Please accept this small token of our appreciation. I hope you like scented candles. I think you do.
I do.
Maraming
Ang dami, as in super. Because sobrang negative ng lugar na to pag puro counseling,
Oh, well,
diba?
very true.
So talagang at least pag-alis ng ng negativity.
There you have it, Lasalians. That was a treat, wasn't it? Till next time, and Doc, live Jesus in your heart.
Forever!
Thank you and goodbye. Bye!